like to call this special meeting to order. The special meeting is to discuss the governor's reopening of Kansas plan and also discuss and review the reopening plan from the Montgomery County Health Department, Emergency Management. And so tonight, kind of highlight that the governor last night announced her reopening plan. It's a three-phase plan. Phase one will begin May 4th, and then 14 days later, May 18th, phase two will begin, and then no earlier than June 1st, phase three will begin. Phase one addresses gatherings. The limit is still no gathering larger than 10. A recommendation that individuals' masks are strongly encouraged in public settings, maintain the 6-foot social distance. Employers' telework is strongly encouraged when possible. Any employee exhibiting symptoms should be required to stay at home. Travel, minimize or avoid non-essential travel, and then follow the KDHE travel and quarantine guidelines for travel to high-risk areas. Activities not allowed to open are community centers, large entertainment venues with capacities of 2,000 plus, fairs, festivals, parades, and graduations, public swimming pools, organized sports facilities, summer camps. Establishments not allowed to open are bars, nightclubs, excluding already operating curb service and carryout services, casinos that are non-tribal, indoor leisure spaces, fitness centers and gyms, personal service businesses where close contact cannot be avoided, and education activities and venues allowed to operate, child care facilities, and libraries. Then in phase two, the gatherings increased to 30. The individual, employers, and travel remains the same. Activities not allowed to open are large entertainment venues with capacity of 2,000 plus, fairs, festivals, parades, graduation and summer camps. Establishments allowed to open, bars and nightclubs at 50% total capacity, casinos, non-tribal, if compliant with guidelines approved by the KDHE. Education activities and venues allowed to operate, child care facilities, libraries, swimming pools, community centers, organized sports facilities, and tournaments with some exceptions. Then phase three, the gatherings increased to 90. Individuals are the same. Employers, on-site staffing is restricted. Travel, non-essential travel may resume. And business and activity restrictions are all education, activity, venues, and establishments may operate pursuant to mass gathering guidelines. In the plan, the county can offer restrictions, and the local governments are allowed to place restrictions, but we can only have restrictions that exceed the governor's restrictions. We cannot remove any of her restrictions that she's placed. So tonight, I thought it'd allow commissioners, if you have questions over the state's guidelines. Representative Kelly is here. We'll allow Jim, if you want to address the commission to explain anything or ask questions. I know you've been on a lot of conference calls with Topeka. If you want to highlight anything, then maybe entertain some questions from the commission. Then after you, Rick Whitson is here. We'll let Rick present the restrictions that the county has placed on top of the state's restrictions. So Jim?
Well, thank you very much, Mayor and Commissioners, for asking me to come to this. And again, as I expressed on our Facebook live broadcast this afternoon, that I appreciate being asked to participate in the task force, COVID task force team. And I do congratulate the city on this team and on what you've accomplished and on top of things. So I think the citizens of Independence are lucky that the group took it on and took it on with vigor and have tried to keep things going and be ready to turn back. They're on the state. I've been on 3 different conference calls today, and the first call I was on included the Attorney General, and so and this was earlier this morning at 9, and the Attorney General said, if anything, this plan in some ways is more restrictive than what was there, and in some ways less restrictive than what's there, but it's got a lot more gray area in between. And so there's a lot more interpretation that's needed, and those definitions aren't exactly out there as to essential organizations, essential activities, and some of the what they said, they have guidelines like you should wear a mask, but he did point out that the executive orders that the governor issued on the opening, phase 1 opening, and all do carry the impact of law, and they do have some enforceability that could be there. It's a Class A misdemeanor if the governor's law is not carried through. He agreed that enforcement would not be easy, and that most law enforcement officers like those that we have in our county would use common sense with dealing it, particularly the first time. But it is there, and then the county and if the city does anything, they also have either a Class C misdemeanor, I think, or I can't remember his exact word, but another type of misdemeanor that could be enforced. So, I mean, the biggest thing on that, he says that, if people aren't paying attention and willfully violating it, it could be enforceable. And 2, if we don't use common sense and follow the rules as outlined in phase 1, 2, and 3, we don't follow 1, we won't move to 2. And if we get to 2 and we don't follow it, we won't move to 3. So it all depends on us being willing to cooperate and to follow the rules and look at the common good of the people around us, that we do that. The governor, there was some question that came up in that call, and then in the call that the governor had this afternoon with legislators on, the executive order. Why did she issue a new executive order and not continue the old one? And basically it was because the court case threw doubts on whether that could be done, and so she issued a new executive order. And the Attorney General said that was probably a way around it. They'll continue to look at that, but so she gets a new 15 days, and the State Finance Council could do 30 days, and then beyond that, it would take the legislature being there, or potentially she could issue a new order to extend it farther. So there's several things there. He indicated that this is new territory. We've never been under an order like this. We've never come out of a stay-at-home order like this in modern times, and this is all uncharted. There's no case law, there's no anything to go by. So, they're working their way through it the same as we are. He indicated that, in gatherings, whether it's a church or whatever, that families can still sit together, but there is the spacing. If the mayor is there with his family at church and I come in, I have to be 6 feet from them. And someone, if they're by themselves or if they're a family, they have to be 6 feet from them. So he indicated that a lot of capacities are determined by how many 6 feet separations you can create. And we talked about the difference, and on all three conference calls, they talked about, restaurants opening and like sports bars and pubs and then what constitutes a bar. So there are differences, and they did talk about those. And and like you mentioned, a local or county could do something more stringent. And the one thing that he pointed out, the Attorney General in the call, is that you really have to be aware of what, if you have say something that would allow you in phase 1 or phase 2 to go to another county, you need to be aware of what that county's doing, because he indicated that Johnson County had already expressed they're going to extend their stay-home order another week, and they will have some businesses that they will not allow to open back up where other counties could. So you have to be aware, and it's difficult because under the governor's order, it was uniform. Under taking the stay-at-home off, it's not uniform. So that's you just have to be aware of what's going on around you. And the governor's executive orders that she issued Executive Order 2028. I think she said that extended almost all of her previous executive orders until May 14th. So most every one of them, except the stay-at-home, and I think she mentioned one other, was extended. So, the medical practice, who could help in medical situations and all were extended until May 14th, and then they'll see from there. In the call this afternoon with the governor, they went through her legal counsel went through like rules that they have they had concentrated on for restaurants, bars, sports bars, and pubs. They talked about certain things that questions that came in. There was a series of questions that they answered. Can baseball practices be held? And the answer was no, because they're an organized practice. If two people want to play tennis, fine. If a team wants to practice, not fine. And just like the ball games, and this is in phase 1. They talked about self-service food and drink. And under the governor's plan, they indicated that self-service drink, it could go back to where it was. But a local government or a county could change that. They could have their own rule. And if you had a food stand, this was one of the questions. Someone could have a food stand, but if you want mustard and ketchup on it, either an employee in the food stand had to put that on, or they had to hand you a packet. There would be no separate condiment stands. Zoos are in phase 2. That was answered. Dance studios are in phase 2. That was answered. Wedding receptions in a building like this, they could not be held. But in a place that, because it's a public, I think he called them a community center type deal. but there would be some other ways you could hold them. He talked about the church rules that were talked about, and they also talked about there's a website now just launched yesterday or the day before, covid.ks.gov, and it indicated that it had all the KDHE sanitation rules, deep cleaning rules, and it had outlined different organizations like the barbers or the beauty shop operators or whatever. Their organizations have put out rules, and all those you can access out there. And that was covid.ks.gov. I looked at it. It is loaded with stuff. And let's see, there were a couple other questions, but elective surgeries were allowed under their plan, and they encouraged individuals to go ahead and start taking care of their routine medical care. So I think that was the end. The only other question that was interesting, there was a question in there about, and it was from a legislator. So who is the governor, since everything is closed, who is the governor having color and cut and everything her hair? And she did answer that question, and that she's fortunate she doesn't have gray hair, a heredity issue, and her hair is being trimmed by not a licensed barber or beautician, but by a licensed physician, her husband, and she only lets him trim the edges. That's it. So she did field that question, and so that was the most ridiculous one that came up on the call. But the rest of them were all ones that I think everyone is hearing, and so they did provide some answers on the call today. So if I came out of any of it, is that when Monday comes around, we won't know all the answers, and Rick will come closer to knowing the answers than some of us will. But I mean, you won't know them all, and there's a lot of things will be coming out probably during the week where a question comes up, and then they come out with guidance, because there isn't near as much guidance in the plan now as there was the stay-at-home plan. So I think that would outline kind of what I picked up from the three calls that I was on today.
Okay, thank you. Commissioner Ususi, do you have any questions for Representative Kelly?
No, I just want to reiterate what the governor had stated earlier, and it's in this Montgomery County publication that I have here. And you're right, it depends on how we handle each of the three phases if we move into the second phase and the third phase. And what it is, it's based on the government's. They will evaluate the state's disease spread, testing rates, death rates, hospitalizations, ability of state and local public health authorities to contain outbreaks and conduct contact tracing, and availability of personal protective equipment when determining if the state should move to the next phase. That is important for people to understand, because we don't get out of phase one if we don't follow these guidelines.
Yeah, you're correct, and there is not any widespread testing going on right now other than in western Kansas, but they did report on the 3:30 call I was on that they got their first shipment of the testing in today. They've ordered 500,000 tests, and they will be coming in phases, and their plan is to try to roll it out across the state to test people that do not have symptoms, just to see what else is out there. And so that's key. That was one of the key things that Dr. Norman stated, and I think Dr. Fucci stated, that you need to be able to test, and the contact tracing was the other. And the state has some CDC people in the state right now that are helping them, and they're in the process of hiring or recruiting from other agencies 400 people to do contact tracing around the state. That's not in place yet. So, but those kind of things have to be in place and have to be proving out before we'd start again. And Dr. Norman, the state's medical doctor, said that just because you start seeing more positives, and that would be because of more testing, that doesn't necessarily mean a negative. That if those tests aren't resulting in hospitalizations and deaths and all, then you would expect to see more positives once you start testing more. But that's a key to knowing too when you can move from 1 to 2 to 3, and hopefully that will be in place if they keep arriving. Can't remember what he said. 25 or so thousand tests a week should be arriving here in the next weeks, and they will try to ship those out, going to probably the higher report counties first and then working their way down. But so that's a key to move. And if people, just ignore the guidelines and they ignore the mass gatherings, we could be right back where we were. And we got to remember that the prediction by a lot of the experts is in the fall, this could be back again. Maybe not worse, maybe worse, but you got the Spanish flu. I think people started celebrating the end of the war, and all of a sudden they had another big outbreak come up, and they were right back where they were before. So that's one thing I think everyone has to be constantly aware of, that we follow the rules, washing your hands, staying 6 feet, wearing a mask when you're outside, particularly in the early phases, so that we can move from phase to phase and get ourselves, as I stated on our Facebook Live, I think it'll be a new normal. And the question came in, why would it be a new normal? And my thought is that I've certainly changed, and I think a lot of other people changed, and I'll be washing my hands a lot more. I'll be staying clear, probably not shaking hands very often, have hand sanitizer in my pocket, and probably walking into a restaurant, if the servers and the cooks aren't wearing a mask, I'll probably go back out. And so those kind of things is what the sanitation guidelines for the restaurants and everything will do. It will increase in the stores, it'll increase the confidence, and because people are jumpy, and I think they'll stay jumpy after this, and much more aware than we were, because it's things you never thought about. Who touched the spoon in the buffet line ahead of you and things like that. So all of those are key, and testing and all of those have to come along for us to be able to move through this in the timeline that she has outlined.
Jim, I have another question in regards to the 25,000 tests. Is that what the state's planning on once these test kits arrive? Is there plan to test 25,000 a week? Or they didn't actually give a number?
They didn't actually they just said they had contracted for and they'd received their first shipment of these tests, and they would keep coming in, and they would be getting them out to test people with no symptoms, just going out into the population. I think, I had read last week that in New York they tested 3,000 people at random in box stores, and around, and 20% of them tested positive. So, that's what these kind of tests will do.
Now, are these tests, will they give the results in like 45 minutes? Is this the new test?
I think Rick would probably maybe know, but I think they're the quick test. I don't think they're the ones you have to send to a lab.
The ones that we're working on getting here are 24 to 48 hours still.
And I think they said in this call today that the ones they got them from China, but that's about the only place you can get big batches quick. That I think they said they were going to be I don't know how long the rapid test is, but a couple hours, or I'm not sure. But I think that's what those were going to be. So they could probably go out into a shopping center, they could go out someplace and run a bunch of tests.
All right, Jim, thank you.
Yep, you bet.
Commissioner Hayes?
Well, Jim, you mentioned that this will be a developing situation, and you also mentioned that covid.ks.gov is one of the sources for us to stay up to date on what the state of Kansas is doing. Is that the best source of information ongoing for what may be happening at the state level?
Well, Rick at the emergency management may get more information than we do, but I think the COVID, I looked at it, I mean, and it's a combination of, it's got information on COVID, it has all the information on guidelines and on what the various trade organizations are putting out for their members, the dental, the restaurant association and all of that, on cleanliness and all. It has information on unemployment. It has the chart. You can pick up the chart there on how many positives there were the day before, and how many deaths and all of that. You can pick that up on that website, plus links to some other things. So I think it's probably an excellent source. And I, from what it sounded, they would keep it updated.
Thank you.
This has been a big undertaking for the whole nation to deal with the COVID crisis, and I know a lot of people have been involved in putting a lot of time into studying and researching, and the research isn't stopping, it's still going on. Appreciate you coming tonight, Jim. I don't know, we might have some questions later, but thank you for updating us on what Topeka is happening and explaining the plan to us. Thank you.
Well, thanks. And I, if I pick up information, otherwise we have generally several conference calls a week. The House leadership has, and other groups. I will pass that on too.
Thank you.
Thank you, Jim.
Thank you, Jim.
And I think each of us have a copy of the plan that was presented to the county commission and reviewed and discussed and authorized. Rick, would you like to share with us what you've taken the state recommendation, their guidelines for the phases, and I believe you've only addressed phase one right now. So would you like to explain where the county has exceeded the state requirements, so we'll have a little better understanding what to expect? And there was a question on the screen I saw that asked what was going to happen Monday, and Monday begins phase one of the three-phase plan with restaurants opening 10 per table, tables 6 foot apart. Closed are casinos, gyms, barbers shops, salons, tattoo, massage, community centers, big venues, fairs, graduation, pools, organized sports, overnight summer camps, licensed daycare camps are open, bars are closed, K-12 higher ed closed, libraries open, swimming pools closed, retail open, community centers closed. And so that's what happens Monday. And so if you'd explain, take us through what you've seen and how you feel the county should exceed the state requirements. So.
Okay. Well, if Representative Kelly wasn't in on the same conference call as I was, he was certainly getting the same information, because he echoed a lot of the very things that we're told. And I'm on 2 a day also. The one at 1 o'clock has all of the state agencies, and it's generally got the governor's attorney, the same one that's talking to Representative Kelly, I'm sure. As far as the testing, we've got all the same information he did. There is something that we're trying to get here, and it adheres to what the theory is of the robust testing. currently, they're not testing anyone in Montgomery County that doesn't have symptoms. Now, they've reduced the fever off of the symptom list, so you don't have to have a fever to be tested, but we're not just testing random people that aren't symptomatic. So the theory of the robust testing is just what Representative Kelly mentioned up there, and we are trying to get something here, but there's some hurdles to jump through. And it's not something that there's enough of it that they're sending it out to a lot of different counties. But I have got approval from local people here to try to get it here, and I'm trying to get that to happen. So I don't want to give out a lot of details and, and then have it not be something that we can make happen. But just want you to know it's something we're trying to get, because we do want to try to test as many people as we can, because we do want a saturation rate. And we want people to know, have a clear understanding of where we are and what's happened. So before I start down this list, what I want everyone to understand in the community is the time frame and the strain that we were under to create this plan. So it's certainly not perfect. If I were to have the same meeting to make these decisions here that we had there, we would have come up with a different plan. Because just exactly what Representative Kelly said is there were a lot of it that was left to interpretation from the governor's plan. So anytime you interpret something, it's interpreted differently depending on the group you're sitting in front of. So these decisions were made based on the information that we had before us. And I will say that we met at 10:30 this morning. The governor sent this out last night. We had a chance to go through it all last night, met this morning at 10:30. The special commission meeting was called for 2 o'clock. And the reason we did that is because we wanted to give the community as much time as possible to plan and prepare for a reopening. If you're a local retail store that hadn't been open, a restaurant, depending on what restrictions we applied, they would need as much time as possible to put those into place by Monday. So, we really did want to have it out early afternoon today. So we'd had a planning team, and it was essentially the health department, emergency management, and then we had the chairman of the county commission in with us also. So he would understand why decisions were made the way they were. So we got done around 12:30. The commission meeting was at 2. I had a conference call at 1. And that conference call answered questions that we didn't have when we made the plan. And I also had one at 5, more questions were answered. So, it's one of those things where I just want people to understand, when you look down through this, it's not perfect, it can't be perfect. But I also want them to know the same thing I do. When the decision makers make decisions that you don't understand and seem to make no sense at all, it's typically because you don't have all the information they had when they made the decision. And I know that to be true with the governor, just like I want people to know that to be true with us. So I didn't understand why we weren't allowed more time to plan and prepare, but I'm sure there were reasons that I just didn't know. So, having said all of that, I'll start at the top. The mass gatherings, of course, what the mentality of the planning committee was is that we wanted to maintain the integrity of the governor's intent. And that was everything that she put in here, even if it wasn't clarified, I think we can get an intent of where she was headed with phase 1. So we don't want to lift restrictions faster than what would be reasonable, but then again, it is a reopening. So it's not an extension of the stay-home order, it's a reopening. So we don't want to do anything too fast, of course. We don't want any extra cases because we open too fast. But on the other hand, although 17 cases in the county is not what we wanted 0, but 17 out of 33,000 is still not so many that we needed to be restrictive. So we felt that what the governor put out was sufficient, and we tried to stay very close to what she gave us. There were some things we filled in on our own that she didn't, and the essential businesses, We went down that list, and the very first one is screen employees for fever and symptoms with a questionnaire in workplace. The reason we came up with that was we knew that a lot of the retail businesses and restaurants may not have access to thermometers. We can't get them ourselves, so that may not be an option. That's why we said a screening tool. There's a questionnaire, and I got one from, I shouldn't mention the business because I told her I wouldn't, but it's a corporate office, and she's the ethics and compliance officer, so she sent us theirs, but we didn't have it at the time that we made this. So we're going to provide that questionnaire, and it's simply, have you traveled outside the United States? Have you gone to any of these locations that are designated as quarantine locations, things like that? Have you had a fever? Have you been sick of recent days? Have you been exposed? It's really that simple. The second one about how all employees must wear masks unless prohibited by other safety equipment. That was one we discussed at length because we weren't certain what all of the major employers in the county were doing. So if you say something like this and they weren't all already doing that, then they would all have to come up with these masks that aren't easy to get right now either. So I texted several of the local managers of the major facilities, and they all said they were already wearing them. So that's how that came about. It doesn't mean that if you're a local business and you don't have access to N95s, then you can just use whatever is available to you. It was a very difficult thing to come up with. Of course, the workspaces, the staggering shifts is nothing anybody wasn't already doing. Common areas, that one was also telecommuting, working from home. Those were all things that we were already doing. Restaurants, there was some clarification on this since we made this also. And we felt like all employees wearing masks and washing hands frequently was an obvious measure. Maintaining 6 feet of social distancing. The groups of 10 sit together at their table. That was something that was discussed at length also. And it's been clarified since also, because we weren't certain how that would be interpreted. But according to the guidance that we got on the last couple of conference calls, it's actually 10 people. The 10 of us could go out and eat and sit together. It doesn't have to be a family or a one unit. 10 people can come in together and sit down and eat at a table. They just have to maintain 6 feet of social distancing around the group. And you can even have more than one. And it doesn't even have to be 10 or less. You can have more than 10. We have 10 in our plan because at the time that was the information we had in front of us. But it was clarified on my 5 o'clock conference call walking in the door that it didn't have to be 10 people in the restaurant. If you went outside the restaurant, then it was a 10-person mass gathering. So you can see that there's a lot of interpretation, a lot of questions are getting answered as we go. This is based on the information we had in front of us. The booths was talked about. If you have a restaurant that has booths, can people sit in booths next to each other? I asked that specifically. The answer was yes, as long as they had a plexiglass barrier between them. Well, then again, you still have interpretation. How tall, how big, how much do you have to cover? I mean, you can see there's endless amounts of questions when you interpret any of this. The restaurants and bars. This is one that what we had in ours was actually the best answer they had gotten. Because that question was asked repeatedly also. Everybody wants to know what's the designation between a restaurant and a bar. We all know we have them here that do both. So what we did in Montgomery County is when the kitchen closes and you stop serving meals, you stop serving liquor. So the bar closes when the kitchen does. That's how you constitute it's a restaurant. And even the governor's attorney and several others were trying to get clarification, and I typed in what we did, and they answered back and said that was exactly what they were trying to portray. So that's how we did. That's how we designated that. The self-serve drinks and buffets, even though it wasn't specified in the governor's plan, I think, common sense and maintaining the integrity of her intent here, that neither one of those should have been allowed. And part of that is not just the touching of all the self-serve things, it's the people that come in and bring their own cup out of their car and refills, in convenience stores and things like that. And in buffets, doesn't really need explanation. If it's the same spoon everybody's dipping food out of, then it was obvious to us that one shouldn't be allowed in phase one. Retail businesses, everything really comes down to social distancing. That's the intent every time. So the social distancing in retail businesses, shopping carts, most of them who have shopping carts are already sanitizing them or providing a means to. The plexiglass barriers, they're just about everywhere I go in right now already, and enhanced cleaning. So none of that really is anything different than what they were already doing. Long-term care, that one was decided for us also. The governor is the one that said no outside visitors. So, and the masks, they were all already wearing masks. Child care is dictated by others than us. The Department of Education gives them specific guidance. So we did have a few things in here that aren't specific to what they get, like just encouraging parents and caregivers not to enter the facility. It's not a law, it's just we encourage you, if you can, to have somebody hand you your child, picking up your 3-year-old or something. But if you got to go in, you have to go in. It's encouraged. Again, personal services, salons, barbershops, nail salons, tanning salons, all of that was dictated by the governor also. There's nothing we did that wasn't in her plan. And then we come to churches, which was the lengthiest discussion that we had. And at the time that we started, when we drafted this, and we edited this at the commission meeting at 2 o'clock, because at the time we didn't have any of this guidance. I mean, I have had that covidks.gov website for quite a while, and I look at it all the time, which, speaking to that, I'll insert this. There is no single source for all of the information that applies to this disaster. There's a multitude of sources, and I've tried to provide all of those. This is one of them, and it's a very good one, but the KDHE's website, the KDHE, the governor's Facebook pages, all of those are good sources to get information from. So when we went to the commission meeting, we had a lengthy discussion about it. When we first planned this, our thought was, even though some of us would like to have seen churches be able to open, the mass gathering was the one issue that prevented that, was mass gatherings. So initially, we thought that it would be considered a mass gathering and that we just weren't going to allow it the first 2 weeks. But then when we discussed it and found out more information, and I had Lee, my assistant, look at the COVIDKS website and found this in there, and the governor's lawyer had mentioned it on the 1 o'clock conference call that was in that on that website. So he printed it off, and we took it directly off that website and into this plan. Word for word, what's in this plan is what's on that website as far as churches go. The clarification there, because if you read this, it says individuals. It says social distancing between individuals. So I asked that on the conference call at 5, and that's not exactly the intent. The intent is families. And that was exactly what we thought, because it doesn't make any sense if my family all drives in the same vehicle to church that we now have to be 6 feet apart. So, and that was their intent as well. So but if you read the first line, it says that they should use online radio and telecommunication tools whenever possible to conduct services or church operations to prevent in person. So the thought is a lot of the larger churches have that capability, and they should continue to use it. But the smaller churches who don't can just maintain social distancing and not have to do that. So that came straight from that website. But the Recreation Commission, that one was decided for us as well. And so was the parks, public spaces, and playground equipment. This is another one that is actually more restrictive than the governor's, because playground equipment is not specified in her plan, but we put it in ours. And the thought there was because it would not be able to maintain the intent of the plan. And that is, if you open that up, now the areas are open, parks and public spaces are open, you can go out there and jog and walk and do those sorts of things. It's just the equipment itself. And the thought there is when parents show up and just send their kids into the playground, there's no way to maintain social distancing or disinfect or clean or any of those things. So the health department and all of us in that agreed that for the next 2 weeks that the playground equipment would be closed. Gyms and fitness centers, that decision was made for us. Public pools were as well. Real estate, that is all the same as the governor's plan except for the open houses. And the intent there was that they would not be able to control the number of people that came at once, or the PPE that they would wear, would they have masks, or would you be able to keep them apart, the social distancing. So they chose to keep the open houses off for the next 2 weeks. Cruising, that is pretty much exactly how the governor designed it. As long as you don't leave your vehicle or congregate, you can cruise. Community events, I think that is pretty specific to what the governor did. Education, the Department of Education sends them specific guidance for education, so we didn't address that. Medical's the same way. I mean, I have CRMC and Labette's reopening plan. They did the same thing we did. They got all the guidance yesterday, and then they had to redo their plans also. Dental and eye clinics. We actually are a little bit more restrictive than what the KDA guidance has sent to the dental. And that is the face shields. They are not required to have face shields according to KDA, but we thought that it was a reasonable precaution. We all agreed that the dental industry as a whole is very, they take a lot of precautions already. You know, they wear masks, they wear gloves, and they do all that on a regular basis. And having spoke to a few of the dentists and eye doctors, they're taking additional precautions and have been now. You know, you have to rinse with antiseptic before you do any procedure, and, you know, a lot of things like that. However, not having face shields, I know when I have my teeth cleaned, there's stuff spraying all over the place. So we implemented the face shields, and I actually supplied them with the face shields already. So dental, that was the only restriction we had above and beyond what the governor had said. And I think that was the last one. So what questions do you have about all of that I hope I can answer?
So on the religious services, it's pretty much like Representative Kelly explained then. It's not individuals that have to be social distanced, but it is the families. And then the capacity would be determined by the number of families or groups that you could have 6 feet apart. But with the requirement for online services, is that just a recommendation that if they can continue, or can a large church have both? Can they open a in-person service with maintaining the social distancing between families to capacity where they reach with that, or are they restricted just to the online service?
Well, with the majority of this plan, it's a recommendation and an encouragement. And as Representative Kelly mentioned, it is a Class C misdemeanor and it can be enforced, but it's highly suggested that you don't. So, but in Montgomery County, they have all adhered very well without having to do that. So we encourage you, if you don't have to have the gathering, to not have the gathering. And I spoke to the pastors of a couple of the biggest churches here in town, and they both already had that in their plan. They had already intended not to do that for the next 2 weeks. So, yes, I mean, if a church were to do it, I've had some complaints about a church that was holding services that I had to address. So we would address it if it happened. What kind of punitive measures would be taken, I really don't know. I can't speak to that. But yes, we encourage you, if you can, continue to do your services online, to do so. And if you don't have those capabilities, you can just social distance.
Okay. And it would be based upon 6 feet between each
Families.
family grouping. So it's not limited to just 10 people in the sanctuary, but a group of 10 family members or 9 family members, then 6 feet between the next group.
Essentially, if you came in the same car, then it doesn't make sense to make you distance now.
Okay. Okay.
Because families is an ambiguous term also, because you could have family, grandma and all her family came, and so now you're all crowded together when you live a county apart, So, but that's,
Yeah.
again, that's a recommendation.
So you're trying to recommend living units as family in the same household or same vehicle?
Right.
Okay. Okay, Commissioner Hayes, do you have any questions?
Well, I understand that we took some steps to be more restrictive than the state in order for us to be safe in the minds of the county commissioners. If there are questions specific to the county's recommendations and guidelines here, are they to call your office with those questions or contact someone else?
No, the health department or my office, either one. I think about everybody in the county knows how to get a hold of me. But to speak to your first comment, our intent was never to be more restrictive than the governor. We really wanted to fall in line with what her recommendations were. But when the things that she didn't address, when we had to, we based them on the information we had at the time. So we had some things that turned out to be more restrictive, but that was not the intent in the beginning. So, I mean, we want to be safe. We do. We don't want to do anything that's going to create more cases in Montgomery County. But on the other hand, it is a reopening, and we are trying to relax some of the things we had been doing. That's the whole purpose. So.
Well, I see on your document here that you're listing the health department's telephone number and the Office of Emergency Management's telephone number. Is there also an online presence that you have?
I spend hours a day answering questions on Facebook. Hours.
So Montgomery County Office of Emergency Management Facebook page would be another place to start with seeking clarification.
Yeah.
And if we search for Montgomery County Office of Emergency Management or Montgomery County Health Department, we'll find those contact information as well, right?
Yeah. There, you can just search Rick Whitson too, and it gets you the same place probably.
I imagine that there will be questions, and I imagine that there will be people who are very anxious to return to servicing their customers and opening their businesses who have been impacted by these restrictions. So they're going to want to be ready to go. Are you going to be available over the weekend for these types of questions?
I have been working 7 days a week for 2 months.
I can imagine.
When you don't address things like this, you know, there were some things in here people said, well, why did you even, if you don't, then you answer the same question over and over and over. So you try to address as much as you can up front to prevent that.
Indeed.
But nonetheless, yeah, I am absolutely prepared for, you know, a barrage of questions over the weekend.
Well, good. I'm glad to hear that. I know our businesses are ready to go, and I'm hopeful that they will get their questions answered and be compliant as well as open.
And I would like to add that if there is a question that anybody really has that I don't have the answer to, every one of these conference calls, I have a way to send in a question by chat. So the presenter, which is KDM, the Kansas Division of Emergency Management, he reads those questions and answers them. You know, so I can get answers to any question that I don't have the answer to tomorrow, because it's at 1 o'clock and 5 o'clock every day, 7 days a week. So if I don't know the answer, I can get it for you pretty quick.
That's good. Thank you, Rick.
Commissioner Ususi?
You know, once those questions come up, Rick, and you have an answer for them, you'll post that information on so people will be able to see it and have a clarification as to what the question was and how it was addressed, which would be good.
That's to prevent having to answer it over and over,
Sure.
so absolutely.
Pardon me, Rick, that microphone needs to be a little closer when you're speaking. When you turn towards us, I think you're speaking away from it.
Sorry.
Yeah, and my other remark is I've been to a couple of health providers here lately, and I know the governor is encouraging people to wear masks, even if you don't have the protective mask that the health workers have, to wear some type of a mask for your own protection, and they're stressing that especially for people that have immune-compromised systems. So if you're going to go out in the public, the doctors are highly encouraging you, if you have to get out, please wear a mask and please practice social distancing. So if you're a cancer survivor or you have respiratory issues already, or if you're diabetic, you have a number of health issues, try to restrict your movements to where you're out in the public. But if for any other reason you have to get out, you don't have a choice, that the doctors are strongly encouraging people to please wear a mask of some sorts, and that will offer you some type of protection versus not wearing anything at all. So, and even though this is a reopening of the businesses in the state, if you're compromised like that, you don't necessarily have to, that doesn't mean an opening for you. If you still need to practice those safe practices, you need to do that, because you need to look out for your health. And there's other ways around that to where you can get help if you need it without exposing yourself. So I want to make sure that people that are listening, highly encourage them to get a mask, wear it when you're out in public if you have health issues. It's very important.
If you followed any of my social media, then you'll know that what I have constantly said from the beginning is, of course, we have all of this guidance. We push out all of the guidance that we can. But in the end, the best way for you to proceed is to do what's right for you, and don't judge others for what they perceive to be right for them. Because the opinions are so vastly opposed on how to react to this situation. I mean, I've got it from people in government. I've got it from doctors. I mean, I have some doctors that have told me this entire thing is blown out of proportion and everything that we're doing is ridiculous. And I know other doctors that think we should be more restrictive than we are. So my point there is if we start pointing fingers and creating issues with your neighbor, it's only going to complicate the entire response. This disaster is unlike any other we've ever seen in our lifetimes. When we have a tornado, a flood, we all come together, we all respond together, we are all like-minded, and we all try to mitigate. We all help in. We all pitch in and help. Resources flood in from all over the place when we have one of those kind of events. This is totally different. This is across the entire nation. So resources are not easy to come by, and opinions are vastly opposed, because the question is what is the biggest crisis? Is it the economy or the virus? And the response has to somehow meet both, and that is not an easy task for anyone. So we try, but how do you keep the economy from suffering further and yet protect our citizens? That is a position that's very difficult to be in. And you were in one of my early meetings with the leaders of the county. You know, what I said is be prepared that whatever decision you make will be open for criticism, because there is no clear right or wrong. So you're going to do something, you're going to make a decision, but these people over here are going to criticize, these people over here are going to say you're awesome. So just be prepared for it, develop thick skin, and do what's right for you. So that if I can get any message across, that's the one I've tried to push. I'm not telling anyone not to notify me if something is happening that we should be aware of, obviously, but then just let us handle it. You know, you don't have all the details. You don't know why some things are going on that may appear to you to be something that shouldn't happen at all, but you may not have all the details. So if I can encourage anyone, that's the main one.
Okay. Thank you, Rick. I know, Kelly, as far as the city, there's been relocation of offices at City Hall for separation of public and staff. We discussed the opening of the rentable space. Do you want to explain to the other commissioners what your thought was on the park buildings and some of those?
Well, we talked about with the park buildings and this was before I received the county's guidelines, but making the maximum that they said in the governor's orders, like the 30 in the phase 2, setting that for the maximum for that building, and then also requiring the social distancing. And of course, some buildings you wouldn't have 30 in because of the size. So there's, that wouldn't always be possible. So we talked about putting some signage up on what those limits are for that particular building, reminding people to follow the social distancing and the guidelines provided by the state and now the county. But it appears like that's probably going to be a phase 2 thing, because I think the county's thing makes it even clearer that we can't do that in phase 1, open those buildings. And then we had also talked about opening the lobby in City Hall, but they said to close all lobbies, so that's going to be a phase 2 thing as well, based on what we have gotten from the county late this afternoon. So that's kind of where we're at on that. We did move our administrative offices to kind of the old imaging part of the building on first floor, where the CT scanner, MRI, radiology, that kind of things. We moved there so that we could separate our offices from the fire EMS. They have most all of the second floor except for the lockdown hallway that the police department has, to kind of segregate our staff from those that have that contact with the potential people that could have COVID positive because of just the nature of their work as first responders, and just to keep that extra barrier between them and our employees. And we did that a few weeks ago or so. It's been a little while, and we're progressing through that. So we have done that as well. And then once we open up we'll open up the lobby, and then probably after that, we're working on an area that we can meet with the public and have the plexiglass to separate the employees and the citizen for everyone's protection, but still have a conversation with them through that. And so we have some areas designated for that. So we've been busy working on that. The wall is almost done that we're working on. Should be done hopefully sometime next week with the door and everything. So that's kind of what we're doing at City Hall. And then we talked about the zoo, but this made it clear that the zoo does not open in phase 1 based on what the county gave us. We had talked about opening the zoo previously, but now that's clear that we cannot do that. And this is all changing. Just like it said, if we don't meet those deadlines, those dates could get passed change. So I'm thankful we have those daily meetings with our pandemic team, and David has a good relationship with Rick, and he keeps us informed, and, it's fluid. It changes all the time, so.
There's been a lot of work behind the scenes the last, I don't know how long. Seems like each day runs together, that this hasn't been just put together carelessly, but a lot of thought and planning and a lot of input from a lot of people to bring us to this point. And we're at the stage now for us. We've seen the state's plan, we've got the county's plan, that if we feel that there are still areas that are of concern to us as a commissioner for the city, that we can also add to the restrictions to provide more security or more protection for our citizens. So at this time, I'd like to hear each commissioner's thought, if you feel we're adequate at this point, or if there's still areas of concern for you that you feel we need explained or to address. So, yes.
I failed to mention this, and Kelly should know this, but it's how the county's going to operate itself. The county commissioners chose to keep the courthouse closed for the next 2 weeks and operate just as they had been before. So it won't be open to the public until the 18th. So
Okay.
I just thought that would be pertinent information.
Good. Well, thank you. Commissioner Ususi, are you comfortable with the two plans that we've reviewed tonight, or there's still some areas that you might have concern with?
No, I think I'm comfortable with what we've heard today already. There will be questions that Rick has mentioned that will come up, and that will bring some clarification. So let's see what the questions bring, and that might open the door to further questions for clarifications, and it gives us a chance to go back and revisit and relook at some of these things to see maybe if we need to tweak this in a certain direction, we can still move on that. But from what I've heard and what I've read and what I've seen today, I'm okay with what we're going through right now.
Okay. Commissioner Hayes?
No, I don't think we need any additional restrictions. I'm fine.
It seems like it's pretty thorough, that each entity has looked at the situations and tried to be thorough on their presentation. And this phase one, if the numbers continue to be stable, will be completed May 18th, and we'll look at phase two. Then phase two, there's some other openings, and we'll hope that we can progress in a safe manner. And I think we set the guidelines. The governor set guidelines. The county health department, emergency management set guidelines, but the ones that will make it work is us. We're responsible for taking care and protecting ourselves. And you've got to forget what anyone else thinks. If you don't feel comfortable going outside without a mask, wear a mask. Carry your hand sanitizer. I was given masks to put in my truck. I've got a hand sanitizer in the truck. I use it. We've got to protect ourselves. And that's the way we'll overcome COVID-19, is each of us doing our part, not expecting to force our convictions on one another, but we each have to do what we're comfortable with. And we can move from phase to phase. So, Rick, do you have anything else you want to add tonight?
There was something, and I lost my train of thought while I was sitting here agreeing with everything you just said.
Representative Kelly, is there anything you feel?
No, I think you covered everything.
Okay, Kelly, Dave, are you comfortable with the recommendation to leave everything as the governor and emergency preparedness and health? Okay,
Yeah, I don't see any need for any additional restrictions at this time.
okay. Well, appreciate everybody for coming.
Yeah,
What-
I have one question for Rick before we
Okay.
go. As far as PPE, we're still in good shape as far as the healthcare facilities, as far as gowns and protective masks and face shields and all that. We're still in reasonably good shape to be able to provide those.
The city of Independence was actually in better shape than most. I think they were better prepared than most of the other entities in the county, but we have exhausted the state's national stockpile. But in the conference call that I was just on at 5, and there's probably an email in there now because I asked him to send it to me, there is another large cache of things that can be requested that just came about today. So we had actually ran out of a lot of different things, but there's been some places that have stepped up to supply those. John Deere passed out thousands and thousands of face shields, so that was very helpful. But no one has ran completely out. We've been very fortunate in Montgomery County, and now that things seem to be trending the other direction, I don't anticipate that being a problem.
Okay. And one other question, as far as increased testing here at this level, when on the horizon, when did you see that starting to take place? Any idea on a timeline? Hate to put you on the spot.
I really don't.
Kind of hard to tell.
No, it's, I mean, to give you a few more details about it, Walmart corporate office has partnered with the Kansas Division of Emergency Management, and they funded a couple of mobile testing trailers. And they can bring this trailer into a site, and how it works is they do it by appointment only, but if you're familiar with how the test works, you can get an awful lot of them done in a day. And they set it up, they do the testing, the results come back in 24 to 48 hours. It doesn't cost anything, there's no input from the county, we don't have to supply workers or anything. All we have to do is track any potential positives. Now, the reason there was a lot of discussion about it, because it's not just, on its face, it sounds like, why would we not? But depending on where it goes, you're inviting a lot of people from a lot of places into your community, especially with our location to Bartlesville, Tulsa, various places like that. So once word got out that trailer was here, you may get a lot of traffic from those places that you didn't necessarily want. It's just something that has to be considered by the leadership before you just absolutely do it. So we are working with it. I've talked to, the day we found out about it, I contacted KDM and asked about it. So it's been in the works for 3 or 4 days now. It's not a very old program. As far as I know, there were only 3 counties that it was scheduled to go in so far. So the county commission seems to be in favor of it. But if when I'm contacted and said that it would probably happen, then I would have to come to you for approval. And the reason is because they don't want to put it anywhere that's not a state-owned property. So initially, what I wanted to do was put it at the Armory in Coffeyville, which is out on the highway away from either city. But that armory is owned by the city and leased to the National Guard, so that they can't do that. So there is no state-owned in Coffeyville. It would have to be somewhere in Independence, either the Armory in Independence, KDOT, some state-owned property is where the only place they will put it. So that's the most of the details about it, but how soon, or even if we will, I don't know. There may be 15 other counties that are on that list also. So And I'm not sure how they're prioritizing those. Is it by population? Is it by saturation? I don't know. All I can tell you is that I did get approval from the county commission to at least look into it and find out if we could get it and what our options are. So if I get that call, you'll be hearing from me.
Okay, Rick. Thank you. Appreciate the information.
Yeah, thank you. Well, I do want to reassure the citizens of Independence that we've been really fortunate to have the leadership. Administrative team Kelly and Dave have done an excellent job of looking into the future, and some of it started a couple years ago, or I don't know how long, because we have been prepared to help supplement PPEs to other entities that did not have them, and that only comes by planning. So, I want to reassure everyone that your safety is being looked at, that you should feel comfortable if you need to call for an ambulance for extended care, that the ambulances are cleaned after each call, sanitized and prepared. The paramedics and firefighters are in protective gear that they change out, and they're concerned with reassuring you that they're safe. The healthcare centers, the hospitals have all taken steps to protect your safety, your health once you go in. We had an emergency room call Sunday, and I had to wait outside. Well, my wife was getting x-rays, and they came out to let me know when it was complete. So they have taken necessary steps to guarantee your health in the facility, and the same with your providers. They've increased their testing, temperature taking at the door, so that you won't have a problem picking up something. And David was sharing with how the numbers had declined, that people were afraid to go if they were sensing a chest pain or something. They're hesitating to call in for treatment, and that's a problem. You've got to respond quick, particularly, in the case of a stroke. You can get treatment in a very short window that will cut down the chance of long-term rehabilitation or damage. But, I want to reassure you that everything is being done to provide a healthy environment in our emergency services and our healthcare facilities. We've been having meetings. Lisa and Tabitha have had meetings with the restaurant owners, preparing them, trying to update them on all the changes coming down the line, so that they'll be ready, that they'll be prepared to provide good quality services once again, but also give you assurance that your health is going to be protected once you go into their facilities. So appreciate commissioners being available on such a short notice, but within 24 hours, we've had the state directive given to us, a county directive. Now we've met and discussed it to see what we need to do as a city for our citizens. I appreciate all your cooperation. So if there's nothing else from the commissioners, Kelly, then I'll make a motion that we adjourn.
Second.
All in favor signify by saying aye.
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 Motion carried.